not be consumed. For the most part, though, it is very antigenic, meaning it creates, there's a ton of food allergies from wheat itself. Wheat, I see, one of the most popular things to be allergic to. So the whole thing that people think is a fad, gluten-free, it's not going away. It's just getting bigger and bigger because of this problem. Casein and whey are from dairy. You see dairy being very inflammatory, very mucus-producing. I see a lot of my type 1 diabetics have a lot of problems with casein and whey, more than they do even with wheat. We know all the cross-reactive grains to wheat are a problem. And again, I talk about that a lot more in my other lectures. All foods that are allergic to are a problem. All the toxins in the food will always put a stress and deregulate your immune system. That's why when we talk about you going organic, or we talk about using raw foods as opposed to cooked foods, those are important facts for you. Just about everybody who studies food will tell you that a raw food diet are the best diets. You can integrate meats and things in there if you're not sensitive to them, but the raw foods are the best foods. Blood glucose. If you fatigue after meals, or you fatigue between meals, if you have sugar cravings, before or after meals or all the time, if you need coffee to function, if you can't stay asleep at night, or you can't get to sleep at night, or you just have a crash in the afternoon at about 2 to 3 p.m. That's when the line grows at Starbucks. If you have any of these problems, these are fluctuating blood sugar problems. You'll have a dampened immune response. You'll continually put stress on your immune system. If you have an autoimmune disease and you haven't regulated these, you haven't fixed it. You're still creating autoimmunity. If you have stress, you have post-traumatic stress disorder, but you have poor relationships, you're having problems with somebody at work, you're overworked, you're traveling a lot for work. Biggest problem I see with people who with stress in work are people that have to fly a lot. They seem to have more problems with radiation as well. I don't think that's because of the machines that they have, though. I think it's the elevation in flight. They're closer.
35,000 feet you're exposed to many
a
times
lot more radiation. That's correct. And then negativity. Plain old, good old-fashioned negativity, right? Want to get?
Yeah,
okay.
tell me.
You can sit closer. Yeah, you can do that. I appreciate that. Okay, so patients with chronic symptoms that respond to gluten and other allergies, we always find multiple tissue autoimmunity. For instance, we talked about the myelin basic protein. That's MS in the making. If you knew that you're susceptible to MS and you knew what you can do to curb it, wouldn't you want to know? Right? If you're a silent autoimmunity and it's myelin basic, you're catching MS before it happens. The cerebellar antibodies, and people who are seasick or loss of function, they bump into, they're very clumsy. We have them walk up and down the hallways. I think I just did that on you, didn't I? Sorry, I did that on you too, didn't I? That's why you're laughing. And you think it's funny, I'll have you do a task when you walk. And whether you're saying something or you're doing something, and suddenly you feel yourself move to a different direction. You walk like you're a zombie. That's a problem with your cerebellum. More times than not, if that also comes along with a wheat allergy or even celiac disease, it's very common to find antibodies to your cerebellum. Parietal antibodies. Now, this is an antibody to your stomach. I see this quite positive in people with Crohn's disease. You know what Crohn's disease is?
Yes, my husband.
Okay. Again, that's similar to celiac. GERD, chronic GERD, gastroesophageal reflux. People are taking Prilosec on a consistent basis and it never goes away. That's a given that's an autoimmune issue. Find it all the time. Islet cells, that's type 2 diabetes. I put diabetes mellitus here. It should not be that. That should be type 2 diabetes. So that's a typo there too. TPO antibodies, that's typical finding for Hashimoto's thyroid. Cardiolipin, I find people positive when they have heart problems or they undiagnosed heart problems or problems they've had for many years, and doctors say, here, just take this Stanton drug and warfarin and you'll be fine. But we later find out that there's an autoimmune relationship to it. You always want to find that so that you know you're not adding more problems to the heart tissue. We find also lipid antibodies to when your hair falls out. So we'll see women who come in and their hair is falling out like on the sides or some funky pattern or in patches, or they have skin patches. we find that the lipid antibodies show up, or the cardiolipid antibodies show up. Intrinsic B12, chronic B12 deficiencies. Anybody know that has to take B12 shots? Anybody? You have to take B12 shots?
I use it to stop my headaches.
Okay. People who have to keep using B12 shots, or people who keep testing B12 deficient, we take intrinsic antibodies and we find if that's positive, that's going to be something that's going to keep you from absorbing B12. So it becomes an absorption problem. The GAD one's a little different. That's for type 1 diabetes, but GAD is something else that's in your brain. That's a brain marker too. So people who can't shut their mind off at night, people who have chronic anxiety or anxiety for multiple reasons, they often will test positive to a GAD antibody. It's your inability to make GABA in your brain because your immune system's attacking that enzyme. Does that make sense? No, thanks. You're good. Okay, now, I can go on for a couple hours with this. I made way too many slides for this presentation. You're the first for this one, by the way. This is the first time I've done this one. I get so many people with this stuff, I want to do one especially just for autoimmune. So I'm going to go through these kind of quick. So if you want to know a little bit about this, the idea here is to give you an idea of what I find with these types of autoimmunity. Does that make sense? I'll read them out to you too so you can see it. If you want, you want to trade places with
There's a chair
Diana?
over here, Gene, if you
Mom,
want
I'm
it.
There's a chair right here.
It feels better. You can sit over here, Mom. There are two, actually.
There you go. Yeah, bring your pillow. There you go. Okay, so the idea, these are some of the antibodies that are positive with that. These are antibodies to a variety of different bugs in your gut, to the tissue of your intestines, especially here, this is for celiac, stomach. A lot of times we'll find anemia. We'll find that parietal cell antibodies cause anemia. Fatigue from that anemia. Burning and bloating. Chronic GERD and ulcers. Abdominal pain that's sort of migrating or it sticks to one area and nobody can solve the problem. Intestinal permeability or leaky gut. If it's chronic, these can be some of these stomach and intestinal autoimmunities. So if somebody also has, somebody want to sneak in here? We'll have to do this at the library next time, I think. Hi there, come on in. That's okay, come on in. Better late than never. If you want, just try and zigzag your way through here, and there's a seat for you right over here. Okay? Systemic inflammation. A lot of times when people have a lot of inflammation all over their body, they kind of don't know why. You know, I exercise, but I get really inflamed when I exercise. This might be a problem with the intestinal lining, just at multiple levels. If there's multiple food sensitivities, and it's always a chronic thing, what food sensitivity are you going to come up with next? There's usually an autoimmune relationship to it. And then if there's just varied symptoms after eating, sometimes you eat something, you feel good, sometimes you don't. Sometimes you're bloated, sometimes you're not. Sometimes it gives you diarrhea, sometimes it doesn't. Sometimes it just constipates you. Again, varied symptoms with eating can also be an autoimmunity. Thanks. Silent thyroid. You have fatigue. You have no idea. The fatigue just keeps getting worse. You have sudden weight gain with it. It's just creeping. And you exercise and nothing's happening to lose that weight. Depression and anxiety that don't seem to be for any reason at all. Or it seems to be that a situational problem creates more anxiety and depression than it should. Inability to lose weight. And you also have, a lot of times we'll see a normal TSH. That's how they monitor whether you're hypothyroid or hyperthyroid. If they're just running a TSH to assess your thyroid, it's undermanaged. You're not getting the right blood tests. So the whole thyroid panel should be done. The most I usually ever see, the most common is just the TSH, T3, and T4, and that's it. There's still 12 other markers you can look at, including the antibody markers. So anyways, that's here's silent cardiac autoimmunity. Exercise intolerance. You can only exercise to a certain level and you never can surpass that. Angina, that they don't have any real understanding of it. You know, if they do a angioplasty, or I'm sorry, an angiogram, and they're looking at your heart function and they find, oh yeah, you have 90% occlusion of your left descending artery of your atrium. That's a problem. That's probably not this. But if you have angina and they're not sure why, again, we always check cardiac antibodies. Breathlessness, they're always and always sighing, always yawning. Yawning and sighing are a way your immune system or your nervous system is trying to get more oxygen to your brain. Same with breathlessness, where it's just you walk upstairs and you just have to stop, catch your breath. Edema, that's inflammation and pooling in your extremities. Palpitations of the heart. Unexplained heart symptoms. It's basically people coming in, they're taking a drug for their heart, not sure why, but they run the antibodies and there it is. There you go. Thank you. Chronic fatigue. This is what I find with people that have problems with blood sugar issues. They can't control their blood sugar. It goes too high or it goes too low. People with chronic fatigue syndrome will often show up with this. Just general muscle weakness, even when people work out. Because I find this when people work out. And they always say, gosh, I lift weights and I fall apart. I'm 2.5 pounds. I do this for 2 minutes and I'm done. Salt cravings. That's more of a pituitary issue related to this, but unexplained dizziness, meaning I'm getting dizzy again here and it's like you're going to pass out. It's not the vertigo, dizziness. Weight loss, confusion, diarrhea, and nausea. Patchy hair loss, patchy skin. This is a necrotic issue too, where it almost looks like the skin might be sort of dying off in patches. Cramping in the hands and feet. Decreased brain function. That's both cognitively and sort of brain fog. Pregnancy complications. I see this a lot here. Miscarriage, nosebleeds, bleeding gums. I've had a lot of women coming in, they want to get pregnant, or women want to get pregnant, couples. And we run these really beautiful hormone profiles for them that show what their hormones are doing over a month period. And we see that, gosh, that looks fairly good. There shouldn't be any reason why you're getting pregnant. They've had all these other different tests. Suddenly we run an autoimmune profile on them, and they realize that, hey, there's a problem here. This happened with a male who get his wife pregnant. We ran antibodies to his sperm, and he had positive antibodies there. So we know now that's going to keep his testosterone low and his sperm count low. Again, the miscarriages, again, if they're holding a baby, and there's a high prevalence for autoimmunity, if they're holding a baby that's just forming there in the uterine lining, the immune system can attack that. And that's when you're going to have a miscarriage. Does that make sense? Mm-hmm. So we found that quite a bit. Again, erectile dysfunction, loss of muscle mass, low libido, depression, lack of motivation, early menopause symptoms, or menopause symptoms that never go away with hormone replacement therapy. Dry skin, dry hair, weak nails. Again, we find testicular and ovarian antibodies positive to these things quite a bit. Especially with men, again, they've gone through testosterone therapy and it didn't work well. Felt great for about a week and then all of a sudden they got worse. And women with ovarian issues of all sorts really will all come up with problems here. There's also antibody tests as well for the hormone itself. And joint autoimmunity. Oh, I got my sipper here. Swollen, tender, warm, stiff joints. Multiple joints are involved, or again, migrating problems, meaning one day it's your ankles, next day it's your wrists. Symptoms are increased by stress, diet, or lack of sleep. So in other words, you have that fight with your spouse, right? And it gives you that achy joint. This can also be an issue where it activates autoimmune relationship to tissue in your joints. The collagen, or the fibrous tissue, or even muscle and ligament. Symptoms are not always increased by strain or load. In other words, you pick up big boxes, and boy, yeah, I feel a little tender in my back. Well, they could eat something, and boy, I feel a little tender in my back. Does that make sense? So this is usually, when it's brought on by a strain, it's usually brought on by an activity, or sitting in one place all day and your back hurts, and you're not used to doing that. That's a little different. This would be, your back starts hurting for no reason. You wake up with it. Why does my back hurt now? I was sleeping all